be able to show my face, but luckily I have a picture set on Zoom. So thank you guys for joining the group. Today, well, I'm Tasha Dixon. I'm a licensed marriage and family therapist. And currently I am a part of the TRDRP smoking cessation project happening in Los Angeles County. My role is a behavioral health specialist where I provide training and support to facilitators in the different clinics within LA County, training them to a specific curriculum for group counseling for smoking cessation, which we'll talk a little bit about today as well. And then I also offer ongoing support to them to help them navigate through the curriculum, navigate through operating the groups, and we'll talk about how and what happened to the group format when we became in a pandemic and how all of that changed. So again, thank you for joining me. So I'll get started. So group counseling for smoking cessation. So I am very passionate about the well-being of others, just in general, wanting people to heal. And I believe wholeheartedly in therapy and counseling. And I've witnessed it make change. And so why does that have to be different for change in smoking cessation? It definitely doesn't. It can provide a huge help to it. The expectations of this presentation is, I don't think you'll get a vast knowledge of what group counseling is, mainly because I only have an hour. But I'm fully aware that after this, you will understand how group counseling couples with smoking cessation and the many things that it provides for a person who is in the process of wanting to quit smoking or using tobacco, or even wanting to decrease their use of tobacco. So yeah, we can go right into the why. So why group counseling for smoking cessation? So this isn't about group counseling versus individual counseling. It is really just talking about how group counseling can be effective. Participants in a group for smoking cessation and anything can also participate in individual counseling at the same time. So this is more about why would someone attend a group specifically for smoking cessation, and why join others, why sit amongst strangers to talk about their problems, and for some, why put yourself out there and cross over a comfort zone, because it does kind of get in the way of, you know, people's comfort zone when having to share problems. So there are study effects of group therapy for smoking cessation amongst hospital staff. So in 2012, there was a implementation of having in a hospital setting, and the intervention existed amongst group counseling. So 10 meetings of 2 hours each. Sessions were held during a 6-week period, and it was led by well-trained facilitators in each session. Feelings about quitting were discussed in addition to smoking-related topics such as health results and relaxation and nutrition. So every year, a follow-up with the people who participated in this study happened and was organized, and participants were asked to fill in the Fagerstrom nicotine dependency test as well. And the course was evaluated every 6 months, and the results were validated by self-reported abstinence and by measuring exhaled carbon monoxide. And so the result of this was that after a year, 133 out of 368 had quit smoking. And after 2 years, 54 out of 154 quit smoking. And then after 3 years, another 21 out of 66 quit smoking. And after 2 and 3 years, only part of the original group could be approached for evaluation. So they weren't able to really get a full evaluation of all of the participants. But it showed that the therapy alone in this process was really helpful to helping people quit smoking. And honestly, I think personally that it had a lot to do with the follow-up of them as well, because it really helps people to have that accountability and sustainability as well. So why would we use group therapy? So cognitive behavioral group programs for smoking cessation provide intensive support to smokers willing to quit. Now, the key is willing to quit. How we operate our groups in LA County is that willing part is important to a sense. We actually just need a person who smokes to say, I'm curious about it. And then they're able to join the groups and see if it's for them. So they don't have to necessarily say, I'm ready right now to quit, but they just have some curiosity or try to quit before. People tend to smoke more often when they're under a lot of stressful conditions. So coming to group and working through stressful situations and kind of hearing other people with similar differences or similar symptoms or problems really helps them feel supported socially. And the hope is in the groups and how the curriculum is formatted is that they will be able to join together as a social support for each other, even outside of the groups, for accountability. Group therapy offers individuals the opportunity to learn behavioral techniques, for smoking cessation. So they will acquire a lot of different techniques, coping strategies, and supports to help them along the way. And when we talk about the curriculum and a little bit later, you'll see how it is formatted to be a journey for quitting smoking versus pushing people to quit in the immediate. So the best part about being with a group is that you don't have to do everything alone. It's a huge support system. And this is important because the support system provides that commonality. It allows people to, again, to see that they're not alone in this. It groups people together who have, can give advice and feedback for each other simply because they are in the same similar type of situations. And then they're also working with people who have the same similar goals. And so group therapy offers individuals the opportunity to build all of these skills. And, you know, again, going back to the research, it suggests that group therapy was particularly effective when used in conjunction with other interventions as well. So we'll talk about that as we go on. Group members are encouraged to learn to lean on each other in that support system, share things they are struggling with, and help each other find their way. So no one falls off, no one is left alone, no one is, you know, the way that the groups are formatted when we're in a group, it is helpful to see eventually, probably midway through the process of the groups, how they lean on each other, help each other out, pick each other up, and can also identify in each other coming to group that something's off or something's wrong and help them work through some barriers in their daily routine that's affecting their ability to quit smoking. So they get to the opportunity to move forward in their life and on this journey. Group counseling can help people move forward because they're encouraged to support each other, and they're also more likely to move forward when they know other people in the group are holding them accountable for achieving their goals and to decrease or to quit. And they also learn social skills. So this is something that is super important. We have a lot of people who tend to lack in social skills in some form, not all of it, but in some form. So they learn how to share their ideas. They learn how to be heard. A lot of people feel like they don't have a voice and they can't be heard, especially when it comes to their smoking and quitting. A lot of family members tend to tell people, you know, talk about smokers, and there's a big stigma on smoking, how it smells, how much it costs, why do you do it? And so in this format, they're able to share their ideas, open up, collaborate, discuss, interact with others, learn how to brainstorm different things for themselves and goal setting and things like that. And they're building a sense of community amongst themselves. So they also get to reveal themselves. They get to speak the truth, even if their voice shakes. Again, that level of comfort zone that the groups kind of help them um, break through, just being amongst peers who are in the same situation, working towards similar goals, helps them open up and they don't lose who they are. They're able to dream big, focus on those goals, make big goals, and see other people doing it as well, which is also motivating for them. Building healthy relationships. This is something that's important too, because a lot of smokers have the relationship with other smokers that seems to be more strong than having relationships with those who don't smoke because of the stigma. And so now, even though everyone in the group has some form of tobacco use, they can build healthy relationships on the path of making change in their life. And so they follow each other through the beginning to the end, and they build their social network. They build lasting relationships out of the group. And this teaches them how to be in a healthy relationship with other people, if that's a problem for them. The group also offers a safe place. Being afraid to express your beliefs and opinions or even talk is not easy for a lot of people, mostly, for anyone. But it is hard to communicate all of them with the right people in the right place and making sure that you are being heard. Group counseling ensures that all members can talk without ridicule, retaliation, or disrespect from the other groups and the members, and especially from the facilitator. We are offering a sense of unity. Knowing that other people in the community are trying to quit smoking or using tobacco can be a very powerful tool in the abstinence from nicotine and overcoming life's obstacles. And knowing that you are not the only one, that you are part of a group, can be very helpful for many. And you can have this sense of unity that you may not be able to have outside of the group. And this next slide I put here because I thought it was super cute and funny. So it's just a cartoon that says, "Hi, my name is Stacy, and I suffer from apathy." And all of the other groups are like, "Who cares? Who cares? Who cares?" So it's showing how all of them are apathetic in this group, and that they all have that commonality that everyone is in apathy. Nobody cares. And so now we could talk about, okay, well, how do we get people to care? And what do you care about? And kind of honing into why are we like this in that group. And I thought it was just cute. So that's the why, really. That's the why group counseling has proven to be just as effective as individual therapy, and even more so with certain group topics. Being a part of a group and giving support and helping to move forward it provides a learned new social skills with help that will help people reveal a truth about themselves that they probably wouldn't be able to do any other time. So we talked about the why, and now we're going to go into the how. How does this work? How does group counseling help for smoking cessation? And why? How is it even effective for smoking cessation? It is important that we understand that smoking cessation is very hard. Getting someone to quit smoking is a difficult process. We don't want to belittle that. We don't want to minimize that. We know it's a struggle. Most likely, participants coming to the group have already tried numerous times in various different ways to quit smoking. So coming to this specific group, we make it known that we understand the difficulty of it. And we also take away the pressure of needing to quit right here, right now from the participants, so that it is not a process that they'll give up on, or it's a process that they see takes time, and that they control that process themselves. And so how we're doing it in Los Angeles County is through Kick-Ash, the next slide, Brianna. Kick-Ash, a cognitive behavioral approach for smoking cessation groups. Kick-Ash is a curriculum that I wrote for the TRDRP program in Los Angeles County. It is 100% cognitive behavioral, and it's targeted specifically for smoking cessation. It is designed to run a series of 6 groups using a cognitive behavioral model that is evidence to help people make personal changes toward growth and success, and how we focus on changing one's thoughts, feelings, and behaviors dealing with smoking and tobacco use. It really hones into the CBT model of what we think affects how we act and feel and all the way around. And how we also hone into the cycle of, right there, we also hone into the cycle of how they're affecting each other and really helping them see how they have control over making change in this process. So if they can change their thoughts, then most likely their feelings and behavior will end up being different. And so the model really hones into going through how they can do that themselves and teaching them what that looks like and how does that happen. So we talk about core beliefs, helping them identify their core beliefs. Now, we're not talking about their core beliefs of themselves and life necessarily. We're talking about their core beliefs of their smoking behavior. What do you feel about yourself? What do you believe about yourself regarding your smoking? Do you not like yourself because of it? Do you feel like you're never going to quit? Do you think that it's in your family, so this is a thing that's going to be for the rest of your life? We really hone into helping them identify their core beliefs. That way we can focus on how, what change needs to be made and where. And if they believe that they'll never be able to quit, we talk about those thoughts and where that belief comes from and help them reframe those thoughts. The curriculum actually talks about reframing thoughts, restructuring thoughts, and we'll get more into that as well. But it really works to have them focus on themselves so that they can start to believe different and more positive about their smoking behavior and that they can quit and that it is a possibility. So the first nugget, I guess, the first chat, it's not the first session, but I think this is about the third session of the group process where we talk about regulating thoughts. This group is honed in specifically on thoughts. And so we can really determine if we're going to have, we talk about how we think we can have a good day, a bad day, how we determine that, how we wake up, what our thoughts are when we wake up, and how they can make or break us for that day. We talk about regulating them in the process of decreasing or quitting smoking and how much it holds so much weight in their choice to smoke or in that behavior, leading to that behavior of smoking, how their thoughts are so powerful. It's important to reframe negative thoughts into more positive thoughts. So for instance, if we have someone have negative thoughts, I'm a loser, or I'll never win, or I can't win. The reframe is like, all I do, I can win. All I can do is win. No matter what I do, I'm going to come on top because of the level of control that we're teaching them that they have over how they see themselves. And we also talk about how the mind kind of plays tricks on you and you can see it come out in your behavior. So if you wake up in the morning thinking, gosh, this is going to be an awful day. Like, I'm tired. I don't feel like doing this. This is going to be a horrible day. You're going to feel lethargic. You're going to feel tired if you have that thought. And so what is your coping strategy for that? And what do you usually do in that process? You go right to a cigarette and you have a smoke because you're already feeling down. But if you wake up and you think, this is an awful day, I'm so tired, and we teach you how to reframe that to even adding that in. This is going to be I'm so tired that I don't think I can get through this day, but I'm going to try my hardest and I believe I can. When we get into that reframing process of it, it really alters. If I add that, I believe that I can, I'm going to give it all I can, then my feeling is a little more motivated to say, all right, let's get up, let's get this going, we can do this. We're pumping up our feelings just by reframing the thought to a positive. And in that motivation of feeling, I may bypass that cigarette that's right there and go about my day. Now, that doesn't say I'm not going to smoke that whole day, but right then and there, I've already made change in feeling and behavior by reframing my thought. The next session is regulating feelings. So we talk about in this portion of the curriculum how to regulate feelings. One of the things that it hones into is that our feelings are uncontrollable. These are things that happen and they come upon us. If I feel sad, it's because something has happened to make me feel sad or have me feel upset or happy. Those feelings just are evoked by external things. So we can't regulate our feelings in the sense of reframing them or changing them in the moment. So how we teach this in the curriculum is that when you're feeling like you want to smoke, or even when you're feeling just down or in a negative feeling, then we teach and we give them a whole grid of options of activities that they can do to alter the feeling. So if I'm sitting around and I'm sad and I don't want to feel this sad and I just don't like it, so I'm going to smoke. Well, then what can I do to get me out of this sadness right here, right now? I have to do an activity, which is call a friend, watch a funny movie, get up and take a walk. So notice how that activity is an actual behavior. So we are actually, to alter our feelings, we have to do something different. And usually if I watch a funny movie, I'm gonna go from crying to laughing at the movie. So I've altered that feeling. And some of the feelings I feel, we want them to get up, be productive, do something different so that their feeling is altered. And we teach this specifically in the curriculum. The next one is regulating behaviors. So we talk about regulating behaviors and how to make change in that. So if we are, one of the things that the curriculum hones into is recognizing somatic cues. So when we're sad, a normal response to that would be to cry or, to isolate. And so recognizing how you know you're sad, recognize how you know you're angry. And when you can recognize that it's there, before going into the negative behavior of it, you're actually recognizing it and putting something else in place instead of the negative response. So we're teaching them how to respond to these thoughts and to these feelings very differently. So if they can't reframe the thought, they can always go to a list of behaviors that they can do to help reframe it for them, if that makes sense. So I'll go through it a little bit to kind of show you what that's like. So the last session in the curriculum is, the guided imagery is used throughout the groups. It's really honed in on the first group and the last group. This first group, the guided imagery we talk about is help, and I'll show you this in the table of contents of the curriculum. It really shows you how to, the facilitator is walking the participants of the group into a guided imagery of what it would be like to stop smoking. How do you see yourself? What do you imagine yourself doing? How is it different from who you are now as a smoker versus who you'll be not smoking? And then at the end, it's the same thing of like, look how far you've come. And we're just walking them through the guided imagery so that they start to see themselves as people who can actually get there. Like, we're imagining ourselves not smoking anymore. So if you can imagine that, you can do that. And so that's what the purpose of the guided imageries are. So relapse prevention is the last session, but it's also an important session, which I'll talk about too when we get to the curriculum, because it doesn't have to be the last session, but it's set up to be in the series of 6 groups. We want to hone into, this is a perfect quote: do not conclude that a relapse is a permanent failure. Expect to face some setbacks as you work towards your goals. So we normalize that even if you have a lapse or a relapse, that it does not set you all the way back. It's a bump in the road. We're picking it back up. We're getting you back on track where you are in the series of groups or are in your process to help keep you going. We don't want you to feel like you are stunted because you relapsed, that you failed, or that you have to give up. We want to still encourage you to keep going. We're going to talk about how what happened around the relapse, getting in touch and honing into external factors that led to smoking. And so in this relapse prevention session, we talk about putting in place, recognizing your difficult situations or your triggered situations that causes you to smoke. So when you can recognize that and you know that that's coming, then you can then put in place some support. So we also have them list out supports in case this is going on in their life. If they have a high anxiety, if they have co-occurring diagnoses, we talk about honing into those triggers for those diagnoses as well. So this is the table of contents. I don't know how close up you can see it. If you can scroll down to here it is, session 1. So in the, okay, so session 1, the table of contents helps the facilitators to be able to guide through the curriculum pretty easily for them so that they know what's in each session. So each session has an introduction about what the purpose of that session is, what we hope the participants to attain. They all come with group facilitator guidelines on how to generate and use and facilitate each activity that's there for them. So the first session, if you notice, it's called Living Tobacco Free, A Dream for a Lifetime. This is where we really hone into, we do introductions, we do group rules, and we also do the self-visualization activity, which is that guided imagery of seeing yourself as smoke-free, what that's like, really come into just honing into that guided imagery of being smoke-free, putting yourself in that. We also have an activity where it's called Dear Future Self, where we have the participants write a letter to their smoke-free self about getting themselves to this process of wanting to quit, and really praising themselves in this letter for their future smoke-free selves, so that they can also in this session take on that praise in the moment, not just for when they look at this letter later. So we do have them steal the letter, put it away, because we revisit it again in session 6. And then we have a health fact sheet and information, which talks about the benefits to quitting smoking. From if you quit from 0 to 10 minutes, this is what your body will feel like. 1 to 2 months, these are the changes you may notice, and it goes all the way to like 15 years of what the changes are. And we'll probably go to that. I'll remember it's on page 10 or 11. So yeah, and then we hone into core beliefs. So session 2 talks about, so the title of it is Embarking on a Tobacco-Free Journey. So session 1 was dreaming of being smoke-free. Now session 2 is actually embarking on the tobacco-free journey. We're starting it here. So what we do is we identify some triggers to the smoking. What do you usually smoke? Do you smoke when you first wake up? Do you usually smoke in the car? Do you smoke on your lunch breaks? Do you smoke with a group of people after work because you hang out with them? What's around your smoking, and what has it led to? Do you get really anxious and you have to go have a smoke? When you get upset, you have to smoke. We really want to help them identify what their triggers to smoking is, so that now we can take them through the goal setting process. The goal setting process is really fine-tuned. It really helps them learn how to create goals for themselves that are doable. And in this goal setting plan, we make sure that they make not only a smoking cessation goal, but a personal goal, a personal growth goal, a health growth goal. We want them to focus on themselves, not just smoking, but to build themselves up in a positive way so that it continues to move them towards, yes, I can do this. Yes, I am somebody. Yes, I'm important. I need to treat myself as important, so that they can identify smoking as like, okay, I can do better for myself. And then we go over the cognitive triangle. Within the triangle I showed you, thoughts, feelings, behavior. We explain that to them. We explain how it's manipulated and how they all play a part. And then we also very upfront give them coping strategies for difficult times. And we give them coping strategies throughout all of the sessions. However, this one gives them 3 important ones so that they have something early on to be able to grasp to. And it's the normalized coping strategies of deep breathing. We teach them how to do that. Muscle relaxation, we teach them how to do that. And I think it's creating a safe space in the mind, like the imagery, safe space. Session 3. So the title of this one is A Tobacco-Free Journey, Regulating Thoughts. And we talked about how we do that. So if you notice that again, there's an introduction to every session, but that B, weekly goal plan. So every week at the beginning of each session, the goals are reviewed. And mind you, these goals are set for a week. So this week, I am going to not have my morning cigarette 3 times out of the week. So we're going to review that. If they've met that, then we can move on and make another goal. We're going to talk about their personal goals. We're going to talk about, this week I'm going to drink 4 bottles of water 3 days a week. We're going to review all of their goals, and we're making them very easy and simple, because in the beginning, they need to have that success. When you feel that those small things of success, it really pumps you up and motivates you. So every week they're creating new small weekly goals that goes towards their goal of quitting smoking or decreasing smoking. We don't pressure them to say, I'm going to quit. But if you can decrease from 10 cigarettes a day to 4, at the end of the 6 sessions, you've made progress, you're a success. We do thought stopping. There's a whole facilitator's guideline on thought stopping. There's a worry chart. The worry chart just consists of teaching them how to, we have a lot of anxiety, people who worry constantly, which can be contributed to them smoking. So the worry chart teaches them how to kind of sit down with a piece of paper, write all their worries down, set a timer for 10 minutes and worry on all those worries right then and there. And then later on throughout their day, when worries start to pop up in their mind as a thought, they can control it and say, oh no, I can't worry about you right now. It's not worry time. So they put it in another compartment of their brain saying, I'm going to worry about you when it's worry time. Teaching them how they can control their thoughts and allow negative or positive things to come in. But you can actually say, I can't worry about you right now. I'm working. I'm going to put you for worry time. I have a time set up for you to worry. As a group, we talk about reframing thoughts. And one big thing is mindset. We talk about going from a fixed mindset to a growth mindset about themselves and about smoking. So then session 4 is the regulating feelings. Again, they have that weekly goal plan. They're going over the goals. And then we help them identify feelings. I think this is super important, that they even understand how to put a word to the feeling. Sometimes you can ask people like, how does that make you feel? And they say, well, I just think that it's going to make me go crazy. Well, that's not a feeling. How are you feeling? We want them to really hone into their feelings to be able to say mad, angry, sad, disappointed, discouraged, let down, unloved. We give them a chart with all the different feelings on them. And we ask them, like, what do you think you feel the most throughout your days? Just to help them really hone into them. And then we have the happy thoughts and pleasant activities chart, which is what I was saying to you, that goes to what behaviors or activities they can put in place when they feel certain things. And this chart is super, I love it because it actually has, and we'll probably show it. I don't know what page it's on, Brianna, but we'll show it in the sense of, well, what it says is like, if they have cravings, these are the activities they can do if they're craving a smoke. Or it says like, if they have, like a lot of people who smoke have this like hand like needing to move their hands to their mouths. So it talks about like how to keep your hands busy. Oh, she's gonna go to it, great. Yeah, so, this is not the one, but I think you're gonna scroll up a little bit more, but this is one where it's like what they can do. This is the feelings that I was talking about, that we have them see all the different feelings or some of the different feelings. So that one was just pleasant activities, like this list here. We're playing board games, solving a puzzle, planning a trip, wear clothes I like, really having control over activities that make them feel good. Yeah. So it's still on session 4. So we also have to help them identify happy thoughts that trigger happy feelings. So when we talk about identifying triggers, we're going to also help them identifying happy triggers, like things that trigger your good feelings, and then associate pleasant activities with those. And then we're going to talk about being able to identify and utilize a safe, peaceful environment for emotions and thoughts. Like where can you go? What can you do? What makes you feel safe? And sometimes that's even the safe space that you've created in your mind up in session 2. So really wanting them to be able to access brain activity and the control of how they can really regulate themselves and their actions and their choices throughout their life and their days, really honing into that so that they can stop smoking and don't have to rely on that. So session 5, a tobacco-free journey, regulating behaviors. Again, we go over goals, and then we go into the facilitator's guideline of trigger behaviors into alternative behaviors. So what are some behaviors that, again, that would be the behaviors of like smoking or first thing when you wake up. In your weekly goals, they can actually say, I'm going to put my cigarettes in my car. So when I first wake up, I can't access them right then and there to smoke. So that's a trigger behavior. When I wake up, I want to smoke. But if you put the cigarettes all the way outside, all the way in your car, then you're going to have to find an alternative behavior to put in place. You're not going to go running to a car to get a cigarette is the hope. And then we give them a list of alternative behaviors. That's the list actually I was talking about, but we can get to it later. And there's a group facilitators guideline, bridging together the cognitive triangle. So now we're going to reintroduce the triangle to them because we've already talked about feelings, thoughts, and behaviors. Now we're going to bring it all back together and help them see like, oh, okay, this is what we've worked on in the last few weeks. And then we talk about recognizing your behaviors. This is what I was talking about earlier on about the somatic symptoms, the somatic responses that automatically happen when you feel this way, and the behaviors that are likely to come, and then alternative behaviors that you can put in place instead of responding in that negative, normal way. So if you're angry, you start clenching your hands, that's how you know that's your somatic cue. And then you want to hit something. So instead of that response, you probably can talk it out. You probably can take a walk or run, putting something in place. And as soon as you start clenching your fist, you can then recognize like, oh no, I need to do something different. And then session 6 is a tobacco-free lifestyle, living the dream. This is the session about lapse versus relapse. We teach them what lapse is. Lapse is if they smoked one time and that's it. And then they're coming back to group saying, I want to not lapse again. But relapse is if they created a pattern of continued smoking after not smoking for some time. But either way, we have relapse prevention strategies we put in place. We have them identify high-risk triggers and situations that causes barriers to them, especially honing into those with co-occurring disorders who, if you have a co-occurring mental health diagnoses, you're more likely to have a lapse or relapse. So making sure that they're aware of that and putting really strong things in place. We have them identify and write down their supports, people they can go to, their own personal strengths that they have towards success that they can implement in those times when they have lapsed or relapsed, or before they do, we want to prevent it. And then the facilitators can do the activity of increasing awareness and access to resource towards their success. So helping them identify how to access, where they can access, what they can do. And then we revisit that My Dear Tobacco-Free Self letter that they wrote to themselves and see how far they've come in the past 6 weeks. I won't go over bonus session A and bonus session B, but I will say that the groups are set up to where if someone wants to start at group 3, regulating feelings, or group 5, regulating behaviors, they can start there and just repeat. Our facilitators in our clinics are just repeating it nonstop. And so anyone who drops in the group can drop in at any time. They won't be missing it because it's, again, each session is not focusing on the triangle as a whole. It's broken up into parts. So they'll catch it the next way around. And also I want to say, if someone has done all 6 sessions, they've had a decrease from 10 cigarettes a day to 8 cigarettes a day, they can repeat this group until they no longer need it. The bonus sessions are set there for people who have quit smoking and still are relying on the groups to come in and still use it, or if someone had a lapse or someone had a relapse, that bonus session helps the facilitator kind of restructure the whole group to meet that person where they are. Anyone coming in with a lapse or relapse, the group is going to hone into session 6. We're going to just go back to session 6 and talk about it. Because session 6 could be done at any part of this as well. So this is they can repeat it. We don't turn anyone away. You can come in and you can do the groups. So yeah, that's what I had. I wanted to show them page 10 or 11 really quickly. Brianna, it's the health fact sheet. How quitting smoking affects your body. And if you see how it says 20 to 30 minutes quitting, I don't know if you can see it, but I'll tell you what it says. On that left, that red 20 to 30 minutes, your blood pressure and pulse drops, hands and feet start to warm up. At 8 hours, carbon monoxide in your blood drops while oxygen level increases. 48 hours, you have a sense of taste and smell improving. So you're not like just tasting nicotine or that nasty smell from the cigarettes. You start being able to have a healthy sense of taste and smell. 72 hours, bronchial tubes relax. 2 weeks to 3 months, circulation, lung function, stamina improves. And it just goes all the way over to at 15 years, risk of heart disease is similar to a non-smoker. Risk of death is nearly the same as a non-smoker. So we are really making progress in our bodies. The first 20 to 30 minutes, you have not had a cigarette. And so we want to hone that in to show them that it's not a process. If you quit smoking, that it's going to take forever for your body to make change. Your body will make change first day. So I think this is a good, one of the facilitators report that this is a really good, that the participants like this. This is a handout that we give them so that they can keep and have as a reminder. So I will take questions, but I do want to just really 2 minutes talk about when the pandemic hit and our clinics went to either working from home or virtually, what that looked like. And our county is not necessarily set, it wasn't, that happened so quickly. It wasn't set up to say like, oh, we're going to Zoom on these groups. So what they had to do was they had to go to making individual calls with the participants of their groups that they had. They're still getting referrals in throughout this whole last year, and they're still making individual phone calls going through the curriculum. And they have all reported that the individual phone calls have been very successful. The participants really enjoy it. They really want to continue even after session 6. They want to keep going. And then also some of the activities are grouped in a bunch for this. And it's instructed to the facilitators that they can choose which activities they use in their group, because the group's only an hour, so they can't do everything listed. That is why it works when the groups are repeated again, because if I did this activity in groups in session 1, the next session 1, I can do a different activity. So the questions are, is a curriculum available and can they access it? So I was just saying that it was created for the DRP program that we have going in LA County, and it is currently being used by solely them. And the hope is that the curriculum will become available at some point, but when that is, I don't know, maybe Dr. Hurley can assist with that.
We are planning on publishing the manual once the study is complete. But to right now, because of the study design, not every site gets access to the curriculum, so we haven't published it more widely. So as soon as it's published, we're happy to update everybody at the conference so that you know. I wish I could give you a better answer, but yeah, we will publish it usually when the study's over. We think that's still a few years away, unfortunately.
Yeah. And I will say this, if you're a part of a Department of Health Services or a Department of Mental Health Services with LA County, and your site is part of the study and are participating in facilitating groups, and you are in a position where you can facilitate a group, you could definitely come and be trained and have access to the curriculum in that way. But other than that, it's a waiting period. Yeah.
People were just really happy with the content that you had.
Thank you. Thank you guys for joining and coming in. And yeah, if you have any questions, you can email me. I believe that they've emailed the slides and our information over to you, and I'll be happy to answer any questions that you have.
Okay, and we're all back into the main room now, it looks like. Thank you all for bearing with us with our technical difficulties.